I'm going to talk a little bit about carpal tunnel syndrome. Carpal tunnel syndrome is a pretty common disease that affects a lot of people, but there's a lot of misunderstandings or misconceptions about carpal tunnel syndrome. So the wrist bones are called the carpal bones in Latin. So that's the carpal bones, and there's a tunnel that some tendons and ligaments and nerves go through. So we call that tunnel the carpal tunnel. So everybody has a carpal tunnel, but not everybody has carpal tunnel syndrome. The nerve that goes through the carpal tunnel is called the median nerve, and it hooks up the meaty part of the thumb and then the sensation for the thumb, the first, second, and half of the third finger. So if it gets pinched for some reason, you can have affecting the ability to use your thumb as well as sensation to that part of the palm. To diagnose carpal tunnel syndrome, we use a study called the EMG, or nerve conduction study. And unfortunately, there's a lot of misinformation on the internet about EMG. EMG is not a comfortable test, but it should not be painful. We stimulate the nerve and we test to see how fast that nerve is going across the carpal tunnel. And then we take a small little pin and we insert it into a couple of muscles and listen for the electrical activity of the muscle. I sometimes call it like a microphone that we hold right up to the muscle and test it. And based on that, we can then diagnose if you have carpal tunnel syndrome. The ergonomics of carpal tunnel have changed over the last decade or so. You saw in the 90s and early 2000s these weird keyboards with kind of a strange shape to them. They were split, and those kind of fallen out of favor. What we really want is good ergonomics from top down. So that means having your monitor straight ahead where your eyes are. You want to have your hands down to your side with your elbows at 90 degrees, and then your wrists just kind of resting comfortably and not too high up or too high down. And then your hips, your knees, and your ankles should all be at about 90 degrees. So that's good ergonomics for if you're going to be on a computer all the time. Carpal tunnel surgery is a fairly straightforward outpatient procedure. It goes for about an hour, sometimes less, and then you go home the same day. And I tend to be more in favor of surgery in the case of carpal tunnel than I am, for example, the back, because our hands are so intricate and so unique, and the success rates for carpal tunnel surgery are much, much, much higher than things like back surgery or neck surgery. So we tend to recommend having surgical intervention for your carpal tunnel syndrome more aggressively than we would say a back surgery.